All right, let's cut the awkward tension. We're talking about vaginal discharge today. Yep, I said it. Discharge. Before you click away, hear me out. Whether it's clear, white, or wait, what's that? Knowing what's normal and what's not can save you a lot of worry and even an unnecessary trip to the doctor. Trust me, this is the conversation you didn't know you needed. Why this matters, let's face it. The body does some weird stuff. But vaginal discharge? That's not just a quirk, it's a built-in health report card. And while it's perfectly natural, it's also a topic that makes people clam up faster than, well, you get the point. Personal story teaser, oh, and stick around, because I'm going to share my own wait, is this normal? Moment that had me Googling at 2 a.m. Spoiler alert. It involved a lot of panic and a very patient doctor. Transition. By the end of this video, you'll know what's normal, what's not, and when to check in with your healthcare provider. Plus, we'll bust some myths along the way. Let's dive in. Body. 5 o'clock, 45:00. 1. What is vaginal discharge? 5 to 10 o'clock. Let's start with the basics. Vaginal discharge is your body's way of keeping things clean and healthy. Think of it as your self-cleaning oven, except, way cooler. It's a mix of fluids, cells, and bacteria that help keep the vaginal environment balanced. 2. What's normal? 10 to 20 hours. Clear or white. This is your everyday, nothing to see here discharge. It's usually clear or white and might change consistency, depending on where you are in your menstrual cycle. Egg white-like discharge? That's ovulation saying, hey girl, I'm ready to party. Yellow or slightly cloudy. A pale yellow color isn't necessarily a red flag. It could just be your diet or vitamins playing tricks on you. Odor, a mild, musky smell is normal. Your body isn't a bouquet of roses, and that's okay. But if the smell is strong or fishy, that's worth a chat with your doc. 3. When to be concerned, 20 hours, 30:00. Thick, cottage cheese-like texture. This could mean a yeast infection. Think of it as bread dough vibes, without the baking. Green or gray discharge. This might signal an infection like bacterial vaginosis or trichomoniasis. Time to make that doctor's appointment. Itching or burning, paired with unusual discharge. This could mean an infection or irritation. Don't ignore it. 4. Myth-busting vaginal discharge. 30:00. 40:00. Let's tackle some common myths. Myth 1. Vaginal discharge means you're dirty. Nope. It means you're healthy. Myth 2. Douching makes you cleaner. Wrong. It actually disrupts your natural balance. Myth 3. All discharge is bad. Totally false. It's a sign your body is doing its job. 5. How to maintain vaginal health. 40:00. 45:00. Here are some tips. Wear breathable cotton underwear. Avoid harsh soaps or scented products down there. Stay hydrated. Your body loves water. Practice safe sex to avoid infections. And most importantly, listen to your body. It's smart, like way smarter than we give it credit for. Conclusion. 45:00. 50:00. Personal story, alright. Story time. A couple of years ago, I noticed some unusual discharge and immediately went into panic mode. I called my best friend, Googled like a maniac, and convinced myself it was the end of the world. Turns out it was just a minor yeast infection, easily treated and nothing to lose sleep over. But that experience taught me the importance of knowing what's normal and what's not. Knowledge is power, people. Call to action. Now it's your turn. Let's normalize this conversation. If you found this video helpful, or even just a little less awkward than you expected, give it a thumbs up, share it with a friend, and hit that subscribe button. Let's build a community where we can talk about anything. Yes, even discharge. You got questions, I've got answers, and probably a lot of jokes. So, what exactly is vaginal discharge? It's a mix of cells, bacteria, and fluids produced by your cervix and vagina. Think of it as your body's self-cleaning oven. It removes dead cells and bacteria, keeping things fresh and healthy. Cut to a funny graphic of a tiny oven with soap bubbles. Host, and the cool part? Discharge can actually give you clues about your health, and even where you are in your menstrual cycle. It's like your body's way of sending you little status updates. Segment 2. What's normal? Host holding up a color-coded chart. Host, now let's talk about what's normal. Discharge comes in different colors and consistencies, depending on your cycle, hormones, and even lifestyle. Here's a quick breakdown. Text on screen with visuals. Clear and stretchy? That's ovulation central, your body's way of saying, hey, it's baby-making time. White and creamy. Totally normal, especially before your period. Yellowish? Might just be dry discharge or normal variation, but keep an eye on it. Mild smell? That's fine. Strong, fishy, or foul? We'll get to that in a minute. Host. Also, quick reminder. Discharge shouldn't cause itching, burning, or pain. If it does, that's your cue to check in with a healthcare provider. Segment 3. When to be concerned. Host in a slightly serious tone. Host, okay, so when should you worry? Here are some red flags to watch for. Text on screen with visuals. Unusual colors, green, gray, or frothy. Not normal. Strong, fishy odor. Could be bacterial vaginosis. Chunky, cottage cheese-like. Classic yeast infection. Blood outside your period. Could be hormonal, but also worth checking. Cut to host mimicking a detective with a magnifying glass. Host, if you spot anything unusual, don't panic, just play detective. Track your symptoms and make an appointment with your doctor if things seem off. Segment 4. Common causes of changes. Host holding up props for each point. Host, so what causes changes in discharge? Here are some usual suspects. Hormones, pregnancy, birth control, and your cycle can all affect it. Diet and lifestyle. Eating too much sugar? Wearing tight, non-breathable clothes? Your vagina's not a fan. Infections, yeast, BV, or STIs can throw off your balance. Medications, antibiotics, for example, can mess with your natural flora. Host. Jokingly, in other words, your vagina is sensitive and it likes its balance, just like you when trying to carry too many grocery bags. Segment 5. Tips for a healthy vaginal environment. Host at a table with props like yogurt, cotton underwear, and a water bottle. Host. All right, let's keep things happy down there with these simple tips. Wear breathable underwear. Cotton is queen. Stay hydrated. Water is life, even for your vaginal health. Avoid douching. Your vagina cleans itself. It doesn't need a pressure washer. Eat a balanced diet. Probiotics like yogurt can help maintain healthy flora. Cut to host holding a water bottle. Host, think of your vagina as a garden. With the right care, it'll thrive. Conclusion. Host back in the original setup, smiling warmly. Host, so there you have it, everything you need to know about vaginal discharge. Remember, it's a natural, healthy part of life, and paying attention to it can teach you a lot about your body. Closing line, thanks for watching, and remember, your body is amazing, discharge and all. See you in the next video. Stay healthy, stay informed, and most importantly, stay you.